We'll talk to you about pectin-based wound dressing production. This is a very important topic because in the medical field there always needs to be improvements for the well-being of the people. And wound dressings is a crucial part of the equation. So for improvements in wound dressings, we can talk about first what is a wound dressing. So wound dressings are sort of like band-aids. Basically, you use them on your wounds to help it protect and for promoting healing in that area. And these band-aids are very crucial in our lives. We all use band-aids, and we always will need to use band-aids. They are cheap and they are really easy to use alternative to um, in protecting infections and other problems, and they help us heal better through these wounds. And for example, we would have a bigger wound, we'd have to be rushed to the hospital, right? But at the hospital, they will pretty much use bandages or other tools as well. And are they really good enough? That's what I'm trying to say. Of course, we will always use bandages. Of course, we will always use band-aids that we need. For example, if we cut ourselves a little bit on the finger, we will always use band-aids because they're cheap, they're easy to produce, they're easy to use. But are they really good enough for like serious problems with the human skin? Are they really good enough for solving problems like huge problems, detrimental problems to the human body? So I will talk about hydrocolloid dressings. Now I want to talk about what's the difference between hydrocolloid dressings and bandages or band-aids or other sort of wound healing products. So hydrocolloid dressings, as you can see on the right, they are used when they are used, since they are transparent, they will allow you to see the wound, unlike bandages or any other alternatives. And this is very crucial because when you see the wounds, you will know exactly how it is healing. So, which stage of healing it is at. So, because there are four crucial stages of healing, you will be able to ascertain what is happening exactly, if the healing is going properly or not properly, which is really important because sometimes you may not even know that healing is going bad, if there's an infection, if there's any problems that in the healing, and maybe something bad has happened, you don't know. So for that reason, even transparency alone is a big advantage in that field. And this is not the only effect of a hydrocolloid dressing. They also allow for oxygen travel. So your wound always needs oxygen. The area needs to be oxygenated enough for it to heal properly. Now, band-aids don't completely block out the oxygen, but they reduce it. And same with bandages as well. They always have some holes and some places that air can go in, but it's not enough. And same with humidity. The area of the wound, as you may know, has what is called basically an exuda, which is a liquid that is produced by the wound to heal. But too much liquid can be an issue, or too little liquid could be an issue. There could be like less liquid than needed or more liquid than needed. And this needs to be in an optimal level. So to be in an optimal level, we need to have some sort of indication of how it's going and to be able to properly optimize that level. So not too wet, not too dry, basically a little bit dry but not too much. And for this, hydrocolloid dressings actually help a lot because they have a set amount of humidity that you can set. So if you want, for example, 40% humidity, 40% wetness basically, you will be able to achieve that using the right kind of dressing, and this will help healing tremendously. So who needs this? Well, obviously all of us need band-aids and other sort of wound treatment products, but if we are talking about who needs it all the time in their daily lives, for example, psoriasis patients need it all the time, and they don't have a really good alternative to these bandages and other things. So, for example, a psoriasis patient constantly goes through many different stages of wound problems every day, and the different parts of their body gets damaged just out of nowhere, and they need to have it treated to have a normal life. And for these treatments, we need as much care as possible because the quality of life of a patient is really, really important. So, if they are so helpful and so many people need it, why aren't they more common? You might ask. So, you might say, why aren't these more common? Well, they are harder to produce and they result in metallic waste. And they also need some products like silver, which is really, really expensive to get a hold of because it needs to be 100% pure. So, these kind of problems make it hard to be an alternative to bandages or other commonly used products. So our motivation was to look at low methoxy pectin zeolite hydrogels, which are used in place of these bandages or other alternatives. And since they use not silver or not any mechanical things, they don't have to be hazardous as a metallic waste, or they don't need to be hard to produce. So these gels also have drug releasing capabilities to promote healing, which is also very, very useful. So you can use any kind of drug that helps healing, and you can insert it into the hydrogel or hydrocolloid in this case, and you can use it to help healing in the area or sedate the area to the person's liking. So we use pectin in this instance, and pectin is basically a replacement for the metallic things in the hydrogel. And this pectin is an organically sourced product that is non-toxic and it is easy to produce because it is found in all sorts of citrus and in the shells of the citrus specifically. So, for example, in the shell of a orange, you can find a pectin, and you can extract it to make hydrocolloid gels. And this has effects similar to those metals, which is antibacterial and other helpful effects. So we looked at many possible production dressings, and these production cycles basically show that you can produce it easily and without any like horrible environmental damaging side effects, and this will help us produce these things very easily, very safely, very cheaply, and get an alternative to bandages or band-aids or any other things that are much better and much more effective than otherwise. And so we can see that we reached some goals. So we reached a goal of almost zero waste. We reached a goal of very cheap but very useful wound dressings, which are alternatives to our archaic commonly used bandages and other band-aids. And we also helped the patients that are in need, and they need quality of life, and we helped achieve that. And thanks to this amazing innovation in medical technology, we can finally help alleviate these problems for these patients. And in my opinion, this is a very huge achievement that can be made if enough funding and enough people look into this area. And I believe that this will help result in that as well. So thanks for listening, and um, I hope I was informative.